everyone, it is Natasha. Attention deficit disorder or attention deficit hyperactivity disorder is diagnosed as a range of behavioral disorders occurring primarily in children, including symptoms such as Hi everyone, it is Natasha. Attention deficit disorder or attention deficit hyperactivity disorder is diagnosed as a range of behavioral disorders occurring primarily in children, including symptoms such as poor concentration, hyperactivity, and impulsivity. The diagnostic features of ADD-ADHD usually begin in early childhood. The difference between the two diagnoses is the presence of hyperactive impulsive behaviors. ADHD occurs in many cultures, in about 5% of children and 2.5% of adults. Adults are not normally good historians to be able to remember their behavioral manifestations in their childhood. Adults with ADHD, with the attention and the restlessness, impulsivity may remain problematic even when the hyperactive behaviors has left. The signs and symptoms or behavioral manifestations normally has many settings, including the home, work, and school. Some associated features with ADD-ADHD are mild delays in language, motor, and social development, a low frustration or tolerance, irritability, or mood liability. Academic and work performance are often very impaired. Exhibit cognitive problems on test, on attention, executive function, and or memory. There is also a high suicide attempt rate with comorbid mood, conduct, and substance use disorders. There are 3 severity levels to ADD-ADHD. Mild, where the symptoms are very few and don't cause many impairments to social and work structures. Moderate, the symptoms may fluctuate between both mild and severe. And severe, symptoms cause many impairments in school, work, or social settings. The DSM criteria for ADD and ADHD. A has a pattern of inattention or hyperactivity, impulsivity that interferes with the functioning or development. Inattention. The inattention is shown in different ways. One often fails to pay close attention to schoolwork. They have difficulty maintaining attention in task, often do not seem to be listening and easily distracted, and do not follow through with schoolwork and chores. They have difficulty organizing tasks, avoid and dislikes engaging in anything that requires them to have to sit still, and often lose things such as materials they need for school, work, or just daily living. Inattention can also be when someone is distracted by outside stimulus and they are forgetful to do daily things that they need to do to get through their day. In the hyperactivity and impulsivity section of the DSM criteria, it shows that a person with ADD or ADHD often fidgets or taps, leaves their seats in situations when they're supposed to be remaining seated, run or climb into situations that it is not appropriate, often play or engage in leisure activities quietly. They talk excessively and often blurt out answers before it's their turn. They also have difficulty waiting their turn and often interrupts or intrudes on the conversations of others. Other criteria is several inattentive or hyperactive impulsive symptoms which are present before the age of 12 years old. Several inattentive or hyperactive impulsive symptoms are present in 2 or more settings, meaning home, work, out with friends, or just other activities. There is a clear evidence that the symptoms interfere with and reduce the quality of social, academic, and occupational functioning. The symptoms do not occur exclusively during the course of schizophrenia or any other psychotic mood and are better explained by another mental disorder. ADD and ADHD have many differential diagnoses. With ADD, as with oppositional defiant disorder, there is no show of aggression towards others. In intermittent explosive disorder, they are not opposing to conforming or have an issue doing what someone asks. The fidgetiness and restlessness are not repetitive as with autism. Although preoccupation could be a sign of anxiety, a person with ADD, ADHD, the preoccupation does not present with worry. Although children with ADD, ADHD exhibit significant mood changes in the same day, a manic episode, as in bipolar, will last 4 or more days. In adolescents and adults, it may be difficult to distinguish both personality disorder and ADHD, but it does not include feelings of fear of abandonment, self-injury, or extreme ambivalence.